videos what I have been taking up in obstetrics. So in succession to those videos, today's video I'll be mainly focusing upon as to what are the reasons when the obstetrician or the gynecologist basically they call for ultrasonography. So the reasons for ultrasonography during pregnancy, in this video I'll be summing up the entire reasons or the causes as to what are the conditions where ultrasonography performance it's a must. So beginning with, during pregnancy, this ultrasonography is basically performed when the first reason being that is the estimation of the gestational age, means the time from where the pregnancy has started and how long the pregnancy is there, to estimate the number of days, the duration of the pregnancy as to when the last menstrual cycle was there and up till when, how long the pregnancy is there, how long the woman has conceived. So in order to estimate the gestational age, the ultrasonography procedure is being carried out. The next reason is that the evaluation of the fetal growth in single or multi-fetal growth. So during a single or a multi-fetal growth, what do we find is that it is basically during this multiple pregnancy, or even if it is a pregnancy of a single cause, if it is a single baby is there, if single fetus is there, so just to evaluate the condition of the fetus in during a single or a multi-fetal growth during pregnancy. Now the next reason is that ultrasonography is basically done by there is a call for ultrasonography if there is an vaginal bleeding of undetermined etiology in pregnancy. So during pregnancy, if the pregnant woman complains of a bleeding, and that bleeding, that too it is of an undetermined etiology, where the cause is not getting clear as to how and from where this bleeding is there. So in such conditions, if the suspected causes are not known as to if it is a bleeding of an undetermined etiology, ultrasonography is called upon. Next, the fourth reason for performing an ultrasonography is that during the determination of fetal presentation, when the presenting part cannot be adequately assessed in labor. Now, during parturition or during childbirth, there occur certain situations, there occur certain circumstances where presenting part, means during the parturition process, during the childbirth process, what is the presenting part of the fetus, what is the presenting part of the newborn, what is getting expelled, what is getting the expulsion of the fetus, if the part of the body what is being expelled is not clear. So in such a situation, ultrasonography becomes mandatory, and to assess what is the part, what is the presenting part of the fetus, what is being expelled out, if it is not getting clear, if it is not clear, then in such situations as well, ultrasonography is carried out. So determination of the fetal presentation when the presenting part cannot be adequately assessed in labor. So obviously the lady is in pain, it is the labor pains are going on, and in such a situation that the presenting part is not getting clear during labor, ultrasonography needs to be carried out to determine as to what is the part of the fetus, what is the part of the baby, what is being expelled. Now, the next reason is that during suspected multiple gestation, as I've already said, nowadays in US it is very common that there are multiple fetal growth is there, multiple fetus are there, even triplets are there, twins are there, or any other multiple number of fetuses are being getting there in the uterine cavity. So in such a situation, if it is multiple gestations, triplets, twins, or more number of fetuses are there in a pregnant woman, so in order, if it is suspected that there is multiple gestation, in such situations also the ultrasonography is carried out. Now the next reason, what do we look that during as an adjunct to amniocentesis. So amniocentesis, it is a procedure where it is the amniotic fluid is being taken out from the from the pregnant uterus, and it is being examined for various purposes. So this ultrasonography process, it is also being used as an adjunct to the amniocentesis procedure. Now, the next reason for performing ultrasonography, it is the significant uterine size and clinical dates discrepancy. So, whenever the obstetrician or the gynecologist or the doctor, when he finds that there is a significant discrepancy between the uterine size in any or the other manner, if this kind of a thing is suspected, that the uterine size is having some kind of a discrepancy, or the clinical dates of the menstruation or the menstrual cycle, whatever, if the clinical dates are having such kind of a discrepancy, again the ultrasonography procedure is being carried out. Moving on to the next reason, that the pelvic mass detected clinically. So these actually, the pelvic masses, these are abnormal tumors or a non-benign, or these are non-benign tumors. So this, if it is a pelvic mass, if it is a cyst or a tumor of any unknown etiology, if it is being presented, though if the pelvic mass is detected clinically, in such situations the ultrasonography procedure is being called upon. And next reason is that if it is a suspected hydatiform mole. So in suspected hydatiform mole, it is mostly seen in non-viable pregnancies, and in such non-viable pregnancies, this hydatiform mole, which is also known as the molar pregnancy, if it is such a situation where non-viable pregnancy is there and abnormal tumor mass is there within the uterine cavity, so if it is if it is a case of a suspected hydatiform mole, ultrasonography procedure is carried out to ascertain it. Or in certain situations, when there is ectopic pregnancy, means the pregnancy, the implantation of the implantation of the fetus is not in the uterine cavity, it is somewhere in the fallopian tubes or somewhere any other part of it. So if it is a suspected ectopic pregnancy case, or in suspected fetal death, so in certain situations it is also seen that might be during the in the pregnant female, the fetus died in the womb itself. So if it is a suspected fetal death, or if it is a case of an ectopic pregnancy, ultrasonography becomes the choice. Now, next is the next reason for performing this ultrasonography, it is the intrauterine contraceptive devices localization. Because after placement of these copper Ts and various intrauterine contraceptive devices, the location of it, in order to assess the exact position of it, how it is placed, where it is placed, in such a situation, this ultrasonography is being carried out, and that too in the determination of the ovarian follicle development and the surveillance of it. So the ovarian follicles, how they are developing, how the ovarian cycle is proceeding. So in order to have a surveillance of the ovarian follicle development, this ultrasonography procedure is being carried out. Next reason for performing this ultrasonography is that to determine the biophysical profile of the fetal well-being after 28 weeks of gestation. Because during the entire pregnancy period, it's a basic quest, it is a basic urge for the pregnant women, and even the doctors, they want to ascertain as to what is the biophysical status of the developing fetus. So if it is if in order to determine the biophysical profile of the fetal well-being after 28 weeks of gestation, that whether the fetus is growing well, whether it is developing well, so in such a situations as well, the ultrasonography procedure becomes the choice. And next reason is that a suspected abruptio placenta. So this is the medical terminology where in certain situations, what happens is the placenta is usually attached to the uterine wall. In a normal pregnancy, the placenta is going to adhere, or it is going to lie close to the uterine wall, or it is attached to the uterine wall. But in certain situations, if it is a suspected case of abruptio placenta, where the placenta detaches from the uterine cavity, or where the placenta is going to is detached from the womb, so in such a situation of suspected abruptio placenta, this ultrasonography procedure becomes the option of choice in order to ascertain it, in order to have a look at it. So if it is a suspected case of abruptio placenta, ultrasonography becomes the investigation of choice. Moving on, if there is an abnormal alpha fetoprotein. So in certain situations, it is found that within the maternal, if the maternal alpha fetoprotein is being raised in an abnormal quantity, then again ultrasonography procedure needs to be carried out in order to check any congenital abnormalities what are going to develop, what can develop in an developing fetus, in order to ascertain it. And if the pregnant lady has a previous history of previous congenital anomaly, if she had undergone pregnancies previously, the children which were born to her might be having certain congenital anomalies. In cases of such an history, ultrasonography in the developing fetus is carried out. Now the next reason is that, last but not the least, that the estimation of the fetal weight, and if there is a premature pre-labor rupture of the membranes is there. In certain situations, it has been also found that the pre-labor rupture of membranes, PROM. So this pre-labor rupture of membranes, in order to estimate whether there is a premature pre-labor rupture of membranes is there, or there is an estimation of a fetal weight. So in such situations, ultrasonography procedure is being carried out. And short, in this video, I have tried my level best to summarize point-wise the entire reasons as to what are the conditions, in what all situations this ultrasonography procedure is being carried out in a pregnant woman. Viewers, if you do like this video, give this video a thumbs up. And if you still have any queries or comments, you're most welcome to comment me in the comment section. And if there are certain topics, if you want what you want for me to be discussed, you are most welcome to comment me in the comment section and let me know. I'll certainly take up those topics for you. And if you like this video, give this video a thumbs up, and don't forget to like, subscribe and share. Thank you for watching.